So my name is Omar Abasad. It is 5:42 p.m., January 12, 2021. So I've been posting a lot of EKGs that resulted from my being microwave assaulted, trapped and assaulted. Just to give you a little sample right now, actually. See those numbers change there? It goes from low to high. When it's over 5, it triggers the alarm. So I'm tagged at high power right now. My ears, my eyes, my other ear, and the head, and the chest. And I'm in pain. My lower stomach, lower belly is tagged. So pretty much my entire body. So when these signals are aimed between your legs, and believe me, I'm not the only one that this is being done to. I tweeted about this. I suspect that COVID-19 is being used as a cover to do this to other people globally. And it has been done for the longest time. I think it's more than 30 years so this has been going on, because there's been people, targets, quote unquote, like myself, who's been talking about this for years. I've been talking about it for at least 10 years, at least. I've been talking about being harassed for more than that, but I did not realize the diabolical systemic program, the plan that was in place that ran it. The rabbit hole goes very deep. So again, in a sitting position, here is the number 118/84, 108 is the heart rate. So I'm just going to give you an idea of what the oximeter looks like. Oximeter. So it's 96, the oxygenation level, the oxygen level, 5.1 PI, 84 heart rate. So it immediately dropped from 108 to 84. Now it's 91. So maybe there. So 96, 7.1, 103. A few seconds ago, it was 84. So 84 to 103 in about 2 seconds. I would think that's tachycardia. So and it's 107 now. So I'm going to take my blood pressure one more time. And then I'm going to take my EKG right on camera. So you would see what these signals do to your body. So let me just take the blood pressure. So I'm just going to do this. And then I have an article I'd like to read. And I'll be taking my blood pressure as I read. So I'm back on my diet, quote unquote, if you can call it a diet. It's a 1 meal a day, full meal a day plan. And the rest of the day, I call them snacks, but not really snacks. A little more than snacks, but one full meal a day. And I did, so the heart rate is 105 on here. But the blood pressure is fine. It's 116/83. So I'm going to take my, just have to moisten my fingers here, because the electrodes, they're like electrodes that you put on your chest when you get an EKG in the doctor's office. So I gotta moisten the fingers. And just taking the EKG for a minute. And the heart rate dropped, which was good. But you can see how fast it happens up and down. So as soon as you're pulsed, the second you're pulsed, your body reacts. My body just happens to be, no, well, it went up again, the heart rate. My body just happens to be very, very, very sensitive. So you get instant results, instant. So the heart rate is going up and down, up and down, up and down very quickly, which is tachycardia. But I'm on camera, so you can see that nothing unusual is happening. And I did get pulsed. My hip is tagged there. And this is what I mean. I am in a targeting program, which means that I am being hit with microwave technology. The microwaves assaults, the microwave assaults causes instant changes in all your vitals, your body temperature. And I'm sure if I took, speaking of my body temperature, if I took my temperature, 36.4, so it must have gone down. .0. So left side, right side. So 0.6 degrees difference in the side, because one side is hotter than the other, because one side of the body is being targeted heavier than the other side. So this is how you know, I'm 36.7 there. So the other side caught up. This is how you know you're hit with microwave weapons. Microwave heats instantly. It's instant. This is how I know it is microwave technology. One of the ways. The other way, of course, is the breakdown. Now, this is a very crude detector. It doesn't give you the breakdown. But this detector here gives you the breakdown of the EF, the RF, and the EMF. RF is high radiant microwaves. RF being this number right here. So there is absolutely no doubt that I'm hit with microwaves. Oops, it's my tea bag, which I leave in because I like my tea strong. So I'm just gonna take my EKG one more time, just peace of mind. I feel fine. I could feel my heart racing, but it's not going up higher than 110. If your heart is racing at 200 plus, then you're in a lot of trouble. But when I go on my elliptical trainer, my heart rate goes up to 150 in half an hour. And if I do, yeah, it's still happening. It's still going up and down. If I do high intensity training, then I could bring it up faster than that. My heart is conditioned. It's very well conditioned. My weight fluctuates, which I'm working on. Once that is under control, then there shouldn't be much of a problem other than the microwaves with which I'm being hit. So tachycardia, 101. So just going to check my blood sugar. So this, I'm red alerted when I do things that the person or persons who's looking at me do not like. I'm being trained, I'm being disciplined. Eating, taking long showers, long being more than 5 minutes, leaving the unit, cooking, sleeping, not allowed to sleep. So when Bill Gates talked about remotely monitoring somebody, which is where we're headed, because right now we're in a tighter lockdown. Effective Thursday, we're going into a state of emergency here in Ontario, Canada. Doug Ford, the premier, and because so many people are dying so quickly. Interestingly enough, microwaves do kill very, very quickly as well. So the blood pressure is fine, and the heart rate is 100. So the heart rate is the same as this, as on the oximeter. So the technologies are working fine because they're matching up each other. But as I was saying, Doug Ford is going to go into a state of emergency with the province, and we're going to be tightly locked down, and everybody's going to be at home. The workplaces are going to be forced to go online unless you're essential services. People can't go into the workplace physically. So all this is forcing people to stay home and go online. And of course, we're going to be monitored at home, right? You're going to have to be monitored. And well, Bill Gates talked about you're being chipped, the vaccine being the start of the whole process. You're brain chipped and hooked up to the cloud. This is what it's all about. Somebody will be monitoring you via the cloud, and it's going to be disciplining you and training you. In my case, I'm a target. So it's about torture, it's about rape, it's about pain, it's about trafficking. When it becomes official, in my case, a target is used for practice. A target is also used by criminals for trafficking. They traffic the targets because they're easy prey and it's all fixed and it's all covered. So a target can be taken advantage of this way. Keep in mind that under COVID-19, we're all targets because COVID-19 can now be used as a cover to do anything to you because there's no longer the common cold. It's all COVID-19. Where did the common cold go? So all the symptoms that you have as a common cold is now rolled into COVID-19. So COVID-19 is being used as a cover. So anything can be done to you with microwave technology, with any other technologies. It's all going to be rolled into COVID-19. It's not a conspiracy. This is what's happening. There is no common cold anymore. Anyway, so back to the point I was trying to make. So we're going to be monitored remotely. And while targets are being used by criminals, and they're trying to pull them in to become criminals, when it's official, the way Bill Gates is laying it out, then you're going to be not disciplined, although technically you will be disciplined. It is exactly what's going to happen. You will be trained. You will be guided. You're going to have a mentor. You're going to have a double. And somebody will be helping you remotely because they'll be tapped into your mind and the way your brain works. And they're going to be reading your thoughts and they're going to be mentoring you, really. But really, of course, it's going to be all about control. So this is what this whole thing here is all about. I suspect this is what I'm being used for experimenting with. What is being rolled out under COVID is what's being practiced on using targets. That's what I meant to say. So, and I just prove to you what it is to be red alerted. You get tachycardia, or you can go into arrhythmia. Tachycardia can get you into arrhythmia. your heart could stop if the power is very, very high and you hit on the chest. Your heart could stop. You can also go in the arrhythmia that way. To demonstrate again. So the power was turned down. But the chest is still tagged at a lower power. I can tell it's a lower power because my skin is not burning as much. Now my ears is being hit when I'm sleeping. So that the assaults while I'm sleeping has become very, very aggressive. I heard that a black man named Rick, a pimp, has the account, and he has a lineup, and he's sending a lot of black people in and white people as well. So during the night, at various times in the night, these people are scheduled to log on to me. So there's a lineup, and different person have their own routine of assaults. Now I shield, but when I shield, the power is turned up. So when the power is turned up, then I get all these symptoms: tachycardia, arrhythmia, skipped heartbeats, high blood pressure, temperature that I just demonstrated going up to 5 degrees on the surface of the skin. So this goes on all night. So this will break you down. It will break you down. So you have to be very, very cognizant of what is going on to be able to save your life, basically. If you put your head in the sand, and a lot of people do, not me, it's not happening to me. And if I talk about being raped in public, I'm going to lose face and I'm going to lose my social standing. Well, keeping in mind that most people by now know what's going on, number one. And number two, are elected to stay quiet about it, meaning that they're actually taking part in it themselves, meaning that they're selling themselves to the highest bidder. So they're selling themselves for money, basically, maybe to their boss, maybe to whoever it is that they want something from. They're selling themselves. So, people are not going to openly talk about it. But whatever reason that you're not talking about it, doesn't mean that it's not happening to you. There are, as I said, there are two categories of people who know about it and talk and are intentionally doing it without openly talking about it. And then there are people who put their heads in the sand. They know that they're targets, but they prefer to believe that nobody will do this to me. I'm not a target. I can't talk about it. I'm going to lose face. But the people who are doing it are satanic. What do you care about what a satanic person think about you? Do you care? Do you care what a murderer thinks about you? Do you care what a rapist thinks about you? Because these are what the perpetrators are. Politicians who are taking part in the program where people are dying because they are locking down everything and people can't get food, can't get money, can't get help. Everything has to be done remotely, and that implies that you're computer savvy and you can set it up and you can buy a computer to start with or have access to it. You can't go to the library, so now you don't have access to the computer. You're assuming that people have access to a computer to go online to do whatever they need to do. So the rest of the people fall by the wayside, and they're going to die. Basically, it's murder. It's out and out murder. Lockdowns are done by murderers, in my opinion. The people who are locking us down are murderers. People are out and out dying because of the lockdown, directly related to the lockdowns. They're dying. They're being murdered. We should not be in lockdowns. There should be other ways to deal with this crisis. And it should be, and my mouth is getting very dry. And it should be very aggressively pursued to find other ways, alternative ways to deal with it other than locking the economy down and putting people essentially in prison. Okay, so I'm not going to go on about that anymore. I feel very deeply about it, as you can tell, very strongly. People who have degrees and so on, and who are lucky enough to be trained to problem solve and given the opportunity in their life to get to that point where they can problem solve, and find alternate ways of surviving are the ones who are surviving this whole crisis that we're facing right now, man-made crisis. The rest of the people, unfortunately, they're going to die. They're going to be killed. They're murdered. They're being murdered. So I got this link on Cutting Through the Matrix website, and I'll post this link to the link to his website, and it's called the Internet of Bodies is here. So this is in the World Economic Forum. The Internet of Bodies is here. This is how it could change our lives. This is the title of the article. And the bullet points at the top. We are entering the era of the Internet of Bodies, collecting our physical data via a range of devices that can be implanted, swallowed, or worn, swallowed. The result is a huge amount of health-related data that could improve human well-being around the world and prove crucial in fighting the COVID-19 pandemic. But a number of risks and challenges must be addressed to realize the potential of this technology, from privacy issues to practical hurdles. In the special wards of Shanghai's Public Health Clinical Center, nurses use smart thermometers to check the temperatures of COVID-19 patients. Each person's temperature is recorded with a sensor, reducing the risk of infection through contact, and the data is sent to an observation dashboard. An abnormal result triggers an alert to medical staff, who can then intervene promptly. The gathered data also allows medics to analyze trends over time. The smart thermometers are designed by, After the Internet of Things, which transformed the way we live, travel, and work by connecting everyday objects to the internet, it's now time for the Internet of Bodies. So let me read that again. After the Internet of Things, which transformed the way we live, travel, and work. So I just got a heart palpitation because my chest is being pulsed there, because I'm not supposed to be doing what I'm doing. My chest is being pulsed. Again, like I said, I'm being trained. My hips are also being moisten I'm being trained. So the person who's looking on, the trainer at the moment, or trainers, don't like what I'm doing. Yep, definitely getting palpitations. And I'll post this when I'm done. Still tachycardia, but it settles down after. It could be seconds or it could be minutes afterwards. It will settle down. It depends on how high the power is. So my hips are being pulsed. So the hips, that's the hips. So here we have a normal reading. So it was fast and slow and fast and slow, but the reading came, the tag came up as normal. But you're seeing live what effects these pulses can have. So let me just go back to reading here. And this is how hard it is sometimes to concentrate. And this is what happens in the workplace as well. Okay, so again, so after the Internet of Things, which transformed the way we live, travel, and work by connecting everyday objects to the internet, it's now time for the Internet of Bodies. This means collecting our physical data via devices can be implanted, swallowed, was simply worn, generating huge amounts of health-related information. Some of these solutions, such as fitness trackers, are an extension of the Internet of Things. But because the Internet of Bodies centers on the human body and health, it also raises its own specific set of opportunities and challenges, from privacy issues to legal and ethical questions. Most consumers are open to the use of digital in healthcare. Well, definitely there are some benefits, because there are things that I've been telling my doctor, and my doctor is saying, "Use it in your head," possibly. And I have proof now that, of course, what I was saying was true. So top reasons why healthcare consumers prefer digital. This survey was taken in 2018. Search for doctors' ratings and reviews. That's very important. Pay your bills. Monitor your daily health metrics, which I'm doing, which is exactly what I'm doing. Search for a doctor, and so on. So just got another heart palpitation, because again, I'm being pulsed on my chest. So connecting our bodies, as futuristic as the Internet of Bodies may seem, many people are already connected to it through wearable devices. Okay, so they said that before. The smartwatch segment alone has grown into a $13 billion market by 2018, and is projected to increase another 32% to $18 billion by 2021. Smart toothbrushes and other hairbrushes can also let people track patterns in their personal care behavior. Smart hairbrushes, very interesting. Maybe mine can turn my gray hair black. For health professionals, the Internet of Bodies opens the gate to a new era of effective monitoring and treatment. In 2017, the US Federal Drug Administration approved the first use of digital pills in the United States. Yes, folks. Digital pills. Digital pills contain tiny ingestible sensors as well as medicine. Once swallowed, the sensor is activated in the patient's stomach and transmits data to their smartphone or other devices. So the cloud, basically, right? So I just bought a glucometer to measure I'm not diabetic, I'm pre-diabetic. So I thought I'd track my sugar levels. And speaking of data collection, I read some of the reviews on the Amazon site, because I bought it from Amazon. And a lot of people were complaining that to open an account, to store the data, you had to allow your location to be read. The location had to be turned on your phone. So a lot of the people, the consumers, were complaining that what does taking your sugar level measurement reading have to do with the location of your phone? So they're collecting data, basically. In 2018, Kaiser Permanente, I think I pronounced that right, a healthcare provider in California, started a virtual rehab program for patients recovering from heart attacks. The patients share their data with the care providers through a smartwatch, allowing for better monitoring and a closer, more continuous relationship between patient and doctor. Thanks to this innovation, the completion rate of the rehab program rose from less than 50% to 87%, accompanied by a fall in readmission rate and program cost. So there are definitely some benefits. See, personally, I don't mind the digitization of our health, provided, and there is one condition, provided that the patient has control of the data, and has control over what's to be done with the diagnosis using the data. It's up to the patient to say, yes, I want the treatment, or no, I don't want the treatment. It should not be forced. Just like saying the COVID-19 vaccine should be mandatory or not. Of course, it should not be mandatory because it's genetic engineering. Should not, and any vaccine should not be mandatory. You should always have choice. You have the power over your body. You own your body. Your government doesn't own your body. You do not exist in your body for the good of the community. The good of the community should not come first. The individual should come first. The good of the community should not come first. Unless, of course, the person is a serial killer or something. But we are not talking about that. We are talking about something like COVID-19, a preventable disease, a curable disease, a disease that has alternative treatments and could be completely avoided if you take all the right steps. Community concerns should not trump the individual rights and the right of the individual to make a choice. Anyway, so let's go on. Thanks to this innovation, I think a right to choose how you care for your body is a human right. You're born with it. It doesn't belong to the government. Thanks to this innovation, the completion rate of the rehab program, okay, sorry, I did that. The deluge of data collected through such technologies is advancing our understanding of our human behavior, lifestyle, and environmental conditions affect our health. It has also expanded the notion of healthcare beyond the hospital or surgery and into everyday life, which is good, because you should be taking care of yourself every single day of your life, not only when you go to the doctor or do what the doctor tells you. This could prove crucial in fighting the coronavirus pandemic. Keeping track of symptoms could help us stop the spread of infection and quickly detect new cases. I agree completely, provided that the person is the one who's keeping track. The person is keeping track, like I do here. I keep my data. And I know that I don't have a fever when my temperature goes up 5 degrees. If I went to the doctor and told the doctor that, the doctor will tell me I'm nuts because nobody's temperature goes up 5 degrees. I don't think a fever is a 5-degree increase. Keeping track of symptoms could keeping track of symptoms could help us stop the spread of infection. Okay. So researchers are investigating whether data gathered from smartwatches and similar devices can be used as viral infection alerts by tracking the user's heart rate and breathing. So let me read that again. Researchers are investigating whether data gathered from smartwatches and similar devices can be used as a viral infection alerts by tracking the user's heart rate and breathing. So I just showed you tachycardia. Would it be any good to diagnose anything, given that I'm a target? So there's a lot of factors to be taken into account before you come up with a diagnosis. At the same time, this complex and evolving technology raises new regulatory challenges. So what counts as healthcare information? So in most countries, strict regulations exist around personal health information, such as medical records and blood or tissue samples. So there needs to be laws put in place. Got it. So data risks. So I notice when my back and my neck is hit, I do this, which makes you slouch over because you're in pain and makes you look old. So the last paragraph, wrapping it up here. So the Internet of Bodies spreads into every aspect of our existence. We are facing a range of new challenges, but we also have an unprecedented chance to improve our health and well-being and save countless lives. During COVID-19 crisis, using this opportunity and finding solutions to the challenges is a more urgent task than ever. This relies on government agencies and legislative bodies working with the private sector and civil society to create a robust governance framework and to include inferences in the realm of data protection. Devising technological and regulatory standards for interoperability and security could also be crucial to unleashing the power of the newly available data. The key is to collaborate across borders and sectors to fully realize the enormous benefits of this rapidly advancing technology. That's some big fancy words. Devising technological and regulatory standards for interoperability and security would also be crucial to unleashing the power of the newly available data. Standards of interoperability. Okay. So pretty much he's saying that the government should take control. And I disagree completely. You should control. I'm all for the technology, but the government should not have access to your data so that somebody will knock on your door and pull you out without questioning you, is my point. Of course, for people who can't take control, like older people, then that's different. But a healthy adult, educated adult, we're mostly educated in North America, why should you hand over control of your health and your data to the government? You don't, the government doesn't own you. You own the government. But we're losing our democratic status in North America, and we're leaning left. So communist, left. Technocratic with all the data. We're going in the wrong direction. Talk to you another time.